Good evening and welcome to Asaase Business PM with me, Kevin Annan, with my co-host.
Rosemary, Balami.
Tonight on the SDG-Hub, we will discuss the topic SDG-3, Good Health and Wellbeing, a look at Ghana's health sector. And to discuss this, we have with us Dr. Benjamin Nti Mensah. He's a medical laboratory scientist. Business PM is brought to you in partnership with the Center for Sustainable Transformation, CeST. If you just tuned in, you're listening to the SDG-Hub. Good evening once again. It's run by the Center for Sustainable Transformation, CeST, here on Asaase Radio. I'm your host, Kevin Annan, as usual, and I'm here with my co-host, Rosemary Balami, from the Young Reporters for the Environment, Ghana, a program under CeST. Health is a fundamental pillar of sustainable development, and Ghana's commitment to enhancing its healthcare system plays an important role in the global pursuit of a healthier and more equitable world. Over the years, Ghana has embarked on numerous initiatives to address health challenges, aligning with various SDGs. And so today, our spotlight is on the health sector in Ghana. We are going to examine the strides made towards achieving sustainable development, that is SDG Goal 3, Good Health and Wellbeing.
Rightly said, Kevin. Ghana's commitment As Kevin said earlier, Ghana's commitment to achieving the SDGs is palpable,
especially within the realm of healthcare. From reducing maternal and child mortality to combating infectious diseases and leveraging technology for healthcare advancements, the nation has demonstrated resilience in tackling health challenges, embracing innovative solutions and fostering collaboration at local and international levels. Today, we'll explore the stories and the progress made in achieving SDG 3, good health and well-being.
Absolutely, and we are glad to be joined in the studio once again by Dr. Benjamin Nti Mensah, who is a medical laboratory scientist. Welcome, Doc.
Thank you very much.
For starters, can you tell us briefly about yourself and what you do?
Okay, so obviously, aside being a Ghanaian, I'm the person of Benjamin Nti Mensah, and then on a daily basis, I analyze test results and then samples of patients.
Okay. Wow. Is this your personal practice, your private practice, or something like that?
Well,
or you work with a health organization?
Yeah.
Okay, that's okay. So as a medical laboratory scientist, can you provide us with an overview of the current state of health and well-being in Ghana, particularly within the health sector?
Okay, so I would like to digress this question by using the key indicators of the SDGs. So most times they analyze using the maternal mortality rate, the neonatal mortality rate, and then some aspects of the health sector. So currently our maternal mortality rate is 319 per 100,000 live births, and then the neonatal mortality rate is 29 per 1,000 live births. Mm-hmm. So currently Ghana, let's say we are on a good track of improving our health sector, and also the government of Ghana under the auspices of Ministry of Health and then GHS, like Ghana Health Service, are also doing a very good job by expanding our health coverage to the rural areas. Mm-hmm. So currently we have about 68.8% of people that are covered by the National Health Insurance Scheme or a private insurance scheme. So currently I'll say that we're on a good track of improving our healthcare.
That's good to hear. So because we often hear bad stories about our health sector, so you've painted a very good picture for us. But I'm sure it isn't without its challenges, the health sector. So can you tell us some of the challenges that we face as a country in our health sector, and how are they addressed within the framework of the SDGs?
Okay, so I have like two key challenges that I think Ghana is experiencing. The first one is poor hygiene and sanitation. Obviously, recently we are ranked among the most air populated countries, even above India.
Wow. You mean air polluted?
Yeah, air polluted.
So it means that is it air quality?
Yeah, air quality is low.
Yeah, it's very low.
Okay.
And also, we have inadequate financial investment with regards to our workforce. We have the brain drain, and also we have inadequate facilities. So those are the two key challenges that I think Ghana is facing at the moment.
Yeah, and I'm sure you would agree that the main thing would be sanitation. That's one of the biggest challenges we face in this country, which just doesn't seem to go away?
Well, it's going to be hard to curb this particular menace. It's going to be very hard. Looking at the way we act in life as a Ghanaian, it's quite
it's
going to be hard.
No problem.
The culture, the way we do things. But then, how do you think they can be addressed?
Well, I think with enough education and then strict measures being put in place, I think we will be able to curb this particular challenge. In the sense that as a normal Ghanaian, we are very stubborn, and then we are hardened in heart too, in the sense that in the sense that you advise someone today and then the next day he's doing a totally different thing,
because they are used to one way of doing things. So it's hard to change their minds.
Right.
Anyway,
so indeed, moving on, let's look at SDG 3. What are some of the the insights into the key challenges and opportunities for promoting SDG 3? That's good health and well-being.
Well, so I think that the main opportunities are we'll be able to reduce our maternal mortality rate, obviously, and also be able to prevent some certain diseases or certain deaths due to medical error or something, and also be able to end some epidemics like AIDS, tuberculosis, and then malaria, only if we stick to good personal hygiene, and also be able to prevent some substance abuse. And all that. So
indeed. So can you highlight maybe any initiatives you've undertaken to contribute to SDG 3 and the impact you've made, if there are any?
Okay, so personally, way back, I and then a group of people usually will go to the SHS schools to advocate about menstrual health, and then to the boys who would advise them to change their underwears regularly and all that. And so I think those were the key initiatives that I was doing back then. But then there's this current trend, there's this no bed syndrome that we keep hearing about. What would you say about that as well? Well, for the no bed syndrome is basically due to the enormous impact of our lifestyle, in the sense that we have about a huge number of people getting sick each and every day, and then obviously it's going to burden our health facilities. We also have few regional hospitals that are currently taking control of these patients and all that. So I think that if we have enough health facilities, if we improve our various health centers and then clinics or even upgrade them in terms of facilities and all that, not just by name, I think we'll be able to curb something here.
So you would agree with me that at this point there's that sort of lack of resources in our health facilities?
Yes.
Across board.
No doubt about that. We have.
Indeed. So from your perspective, how has the health sector in Ghana evolved over the years in addressing the targets set by SDG 3, and what notable achievements have you witnessed?
Okay, well, I think we are on a good course, as I said earlier, in the sense that if you look at the various key indicators, if you look at SDG 3, they are saying that by 2030 we'll be able to reduce the maternal mortality rate to less than 70 deaths per 100,000 live births. And if you look at the figures that I gave earlier, we are around 219. So I think by 2030 will be less than the 70 that we are talking about.
So you really have that faith that by 2030 we will indeed be able to achieve those targets as a country?
Okay, from my perspective, it's very likely, only if we stick to plan.
Well, so aside from the challenge, the behavioral challenge that we face with regards to how we handle our waste and many other things, which is causing us not to be able to move forward in our health sector, there's also a problem of infrastructure. We lack infrastructure a lot, right? Earlier on, you were saying something about some good waves being made in the rural areas. Government is making some effort to go into the rural areas. Can you give us some details about that? Because I myself do not know much about that.
Oh, okay.
Because the picture that I hear about this is that the rural areas lack. there are even some parts here in Accra that lack infrastructure. So I'm thinking, how do the rural areas get? So enlighten us about the changes that we are facing, the positive changes.
Okay, so the infrastructure can be varied, not just in terms of the edifice and all that. It can be machines. So let's say we can have a chips compound at a particular village, but then there wouldn't be any
machines
like you get it. Yeah, so those aspects we lack them in the sense that they will be able to, as in they will provide those edifices and all that, but then in terms of machines we lack adequate machines. Yeah.
How about the healthcare workers in the rural areas? Are we getting a good number of people going there? Because
no,
I doubt someone would want to be here in Accra and be posted to an obscure village somewhere in the north.
Well, I think that is due to our conditions of services. If only if Ministry of Health or Ghana Health Service will improve their condition of service, I don't think anyone will object going into the village to go and work. Because let's say for 3 months or 4 months your salary won't be coming in and you are still in the village.
Oh, wow.
Obviously it might not be.
So the challenges facing the health sector are multifaceted. They cover a wide range of things: equipment, human resource, personnel, infrastructure, and the behavior of people. Anyway, so as a medical...
Also, but before you move on, Kevin, there's also that brain drain that is happening, like in the health
currently.
Yeah, that's something that's really... I know a number of people who are nurses who are angling very aggressively to leave the country because the systems and the conditions over there are way better than here. And it's going to affect us a lot.
Yes.
Recently, I saw on the news that the headline was that nurses are leaving Ghana in droves.
Wow.
Plenty. A lot of them are leaving. And it's a problem. Brain drain is a problem anywhere. And for the health sector, it's a big problem because there already aren't many of them.
Okay, so the bottom line is that it's all about the conditions of services. If we have right conditions of services, I don't think you would go and live at a particular country that will be restricted to do certain things. You get it? And then the argument on the brighter side is that they will be like, if you go in and work outside the country for a year, you'll be able to pay all the loans that's as compared to you living here and then working 10 years and then still not be able to finance those loans.
Yeah.
And so it's all about we putting good measures in place, like good conditions in place. Yeah.
But these are things that we've said several times. Like, it goes without saying that we have to put good measures in place for people to want to stay and do the work. Yeah. But then we've not seen the changes. So is there, do you think anything is going to change anytime soon?
Okay, me personally, I believe in the Generation Z because most of the times they act according to their words.
Yeah.
But then if you look at the older generation, it's quite hard. They will give you the rhetorics of the political talks and all that, but then the actual work won't be done. And so I think moving forward, I think there are quite young people that are doing amazing work across the country, and then eventually they will hold those positions, and then we'll be able to move on.
So you're trusting the next generation to make the change.
Yeah. How about now? That's the point, because we are losing our human resource.
I'm part of this generation. Do you get it? I'm part of the Generation Z, so hopefully we'll do something better.
We fingers crossed to that. We are hopeful. And for you as a medical professional on the front line, what specific changes or investments do you believe are crucial for Ghana to accelerate towards achieving SDG 3? Investments in the health sector.
Okay, so the two key challenges that are aligned earlier was that first we need to invest in our financial and resources, in the sense that we need to build more hospitals. Also, we need to give medical professionals good conditions of services, and then also we need to provide adequate machines for quite difficult surgeries and all that.
Yeah.
And then also we need to improve our personal hygiene and sanitation. Yeah.
But then the health sector, has this. We have this Ghana Medical Association and all these bodies that fight for the collective good of you all. What are they doing in this regard? Because we even hear that, most hospitals don't even have dialysis machines and all that. So what are they doing? Is there lack of political will to make sure that these, various hospitals have the needed equipment and all that?
Okay, so one challenge is that they have priorities and all that. Okay. Those associations and all that have priorities, and then I don't think I want to tread cautiously.
You should.
I want to tread cautiously in the sense that I don't think it's part of their priority at the moment.
Really?
Yeah, because obviously you wouldn't give huge amounts of money to the blasters, and then you'd be suffering from pain for dialysis machine.
So where are the priorities, Karen? If they are not on the important things, where do you think they are? Unimportant stuff. Like the black stars.
I still want to tread cautiously.
We are in a democratic country, so you are free to air your view. I guess, anyway. Okay, so wrapping up, what are your last words, as a medical professional? Or would you, right now, government is listening, policymakers are listening. What are your last words to them, regarding making sure that they put measures in place to ensure that we achieve, SDG 3 at least by 2030, and also improve upon our health sector?
Okay, so first off, I would want to commend the non-governmental agencies like the UNDP, the World Health Organization, Mary Stopes and all that for the seminars that they do, for their timely seminars. I think it's a good cause, and we all need to act in accordance with that. Also, I would admonish the government to not just build hospitals, they should build the human workforce. Because if you build more hospitals and then you don't have adequate personnel to take charge of in like 2 or 3 months, the place is going to be deteriorated, and you come back to square one. So I think we need to invest more in our human workforce and then give them a perfect good condition of service, and I think we'll be. Also, I'd like to advise the populace about our sedentary lifestyles, because if you look at the non-communicable diseases, they are not acute. Okay. As in they are chronic, they build up for over a certain time, and then it takes control over your body. So I'll admonish the youth coming up that at least we should not be too much centered on our sedentary lifestyle. We should be able to at least exercise once in a while, eat very early, as compared to late night eating and all that. Yeah.
Well, thank you so much, Dr. Benjamin, for sharing your insights this evening. It has been a really interesting conversation. So please tune in same time next week as we continue discussions on all things sustainable development right here on Asaase Radio 99.5, so that people and the planet can prosper. If you have any topic you want us to discuss, please share it with us and email sdghub@cestint.org. Remember, dear listeners, the future is in our hands, and it's our responsibility to ensure a healthier planet for generations to come. Keep raising your voices, keep advocating for change, and keep tuning into the SDG Hub for more insightful conversations. Until next time, stay informed, stay engaged, and stay eco-conscious.
And that's a wrap on the SDG Hub. Thank you for staying with us. We have been speaking to Dr. Benjamin Nti Mensah, a medical laboratory scientist. I've been your host, Kevin Annan, and I did this with my co-host,
Rosemary Balami.
Go back to Caleb.